Hi, my name is Joy Ozurumba. I'm here to perform a central vascular access line dressing, and I'm in my proper school attire. No nail polish, no acrylic, no jewelry, no ring, no watch. Um, I'll perform hand hygiene, and then I'll gather my supplies, and then I'll go to my patient. I'm gonna identify my patient with through patient identifier, and I have the right patient. I'm gonna educate my patient on what I'm about to do, and central line dressing, and I'm gonna offer my patient privacy. Then I will put on my mask. I put on my mask, and I'm gonna offer my patient a mask to put on, or I'm gonna ask my patient to turn their head to the side in order to perform this procedure. Then I'm gonna perform hand hygiene again. I'm gonna put on my non-sterile gloves. So I will start by removing the old dressing on the sides, and I will use my non-dominant hand to hold on the skin while I pull the dressing on all sides, four sides of the dressing. I'm gonna pull it gently, and I'm holding it down with my hand in order not to pull on the skin so hard, as well as maintaining the dressing insertion, not moving it or accidentally pulling it out. So I'm pulling on the dressing to remove the old dressing. Uh, Bear with me, I have a retardant on this. Uh, so the old dressing is out, and I'm gonna discard the old dressing in the trash. I will assess the skin, the insertion site for the skin integrity. I will assess if there's any infiltration, redness, phlebitis, uh, or any kind of abnormalities on the site, and there is none. So I'm gonna remove my gloves and put it in the trash. I'm gonna perform hand hygiene. So right now I'm gonna open my sterile kit, okay? And I'm gonna remove my sterile kit by moving it away from me, okay? Opening it away from me. So I'm gonna use my hand to grab my sterile gloves, holding it to the side. So I'm gonna open my sterile gloves right now. Just touching the flap, the 2-inch flap in order to open my sterile glove. Okay, I'm gonna pinch on the cuff in order to put on my sterile gloves, okay? Okay, so I'm gonna put my hand under the cuff to scoop it up, to scoop up my gloves, to put on my gloves in my second hand. Okay, my sterile gloves are on. So I'm gonna touch the inside of this package, the sterile glove package, which is still sterile, in order to move it out of the way. Okay. Now, what I'm gonna do next, I will use my non-dominant hand to pick up my faucet from my sterile kit. Then I'm gonna pick up my chlorhexidine with my hand. This faucet, I'm gonna be using it to pick up the line in order to hold it up so I can be able to clean. Okay, it won't be on my way. Okay, I'm just holding it up. I'm not pulling. Okay, just holding it up so I can clean. So with chlorhexidine, I'm gonna clean in back and forth motion, horizontally and vertically for 30 seconds. If I'm using alcohol, then I will clean in circular motion. So for the purpose of this, I'm using chlorhexidine, so I'm gonna clean in back and forth motion. Okay, back and forth, 30 seconds, back and forth, 30 seconds, back and forth, 30 seconds, back and forth, 30 seconds. Then I'm gonna clean under, and then I will clean the line. I will set down my this, and these two go to the trash. Okay, I will let this dry. I will let it dry completely. Not panning it, just leaving it to air dry. Okay, so right now it's dry. I'll pick up my dressing, and I'm gonna peel it off. So I'll put this on the dressing, making sure that the insertion side is on the window. Okay, so I'm gonna push it down on four sides, making sure they're firmly secured. Okay, the dressing is firmly secured. Okay, now they're firmly secured, covering the insertion side. I'm gonna peel off the backings. Okay, peeling off the backing. So there's an initial, there's a tag here for initial and date that the dressing was changed. So I'm gonna put this by the side, not covering the insertion side. Just put it by the side of the at the corner of the dressing, and I'm gonna use my pen to write my initial and then write the date. I could write the time too, but this is to show when it was changed and who changed it. Okay, so I'm gonna clean up my working space right now, putting everything away in the trash, and I'll remove my gloves, making sure that my patient is comfortable. Perform hand hygiene. Then I'm gonna document on what I just did.